The number of deaths could increase in the coming weeks as we experience the fallout of Thanksgiving holiday travel. Smaller hospitals are already struggling to keep up with the rising number of COVID-19 patients. As CBS 4's Zach Myers explains now, turning patients away could be on the horizon.
Just last night, Johnson Memorial Hospital was one ICU patient away from not being able to take in any more, and the outlook over the next couple weeks is not good. According to data from COVIDtracking.com, Indiana has the nation's second highest per capita rate of COVID-19 hospitalizations, second only to South Dakota.
I think we're on the brink of not being able to safely take care of patients.
Johnson Memorial Health President Dr. David Dunkel says his people are struggling to keep up. 14 of the hospital's 22 special treatment rooms are occupied by COVID-19 positive patients. At one point last week, 19 rooms were occupied. From the outside, you can see where some of the converted COVID treatment rooms are. The vents on the window are retrofitted there so that they create a negative air pressure. The air from the inside is pumped to the outside.
We have space. We could shut down surgery completely. We have rooms there, again, that we could put patients in if we had to, but we don't have the staff to take care of those patients.
22 Johnson Memorial employees are out of rotation in quarantine right now. That's stretching the staff thin.
We have people that have been great. They've picked up extra shifts. They're working longer hours than normal, but people can only be pushed so far.
Keeping the patients in high spirits has been a hard battle just because, you know, people want to see positivity and that we're gaining ground.
We've tried planning, preparing, and there's really no more preparation you can do. We just take it day by day.
So then you start looking at other avenues. Can we get in some temporary nurses, agency nurses? But again, there's a shortage. I mean, hospitals are getting hit all across the country.
Johnson Memorial leaders are in daily communication with surrounding hospitals and medical centers in case they need to divert patients elsewhere. They haven't reached that point yet.
What keeps me up at night is thinking about what happens when no one can accept a patient.
The hope here is that some of the staff will be able to come back from quarantine before any kind of post-Thanksgiving surge, but that remains to be seen. Reporting in Johnson County, Zach Myers, CBS 4 News.